Good evening, and welcome to McIntosh Academy. For those of you that don't know me, my name is Annie Slothauer, and I have the privilege of serving as the Director of Enrollment Management. It's wonderful to see both familiar faces and lots of new guests joining us tonight. Also with us this evening are members of our administration team, if they want to give a wave. Dr. Tara Zazinski, our head of school, Lara Posback, our Director of Instruction and Associate Head of School, Jody Leatherman, our Director of Curriculum and International Baccalaureate Coordinator, Tammy Vinson, Director of Development and Engagement, and Ocean Selmeyer, our Director of the Early Years Program. We all are wearing our snazzy red MAC gear, so if you want to find us after the presentation and connect, know that you're more than welcome. Right. A little light housekeeping. There are refreshments at the back. Please help yourself. And then if you need a restroom, adult bathrooms are located in this hallway just past this doorway. But here at MAC, we're more than just our snacks and full-size toilets. We're a truly special place, and we're so glad you're here. We are one of the few schools in the state designed specifically for gifted learners. Children who are not only intellectually curious, but also deeply empathetic and globally minded. Our mission is to nurture the keen minds and compassionate hearts of the gifted child in a responsive and caring community of learners. Our students mature into confident, healthy human beings inspired to contribute to a world that needs them. Here at MAC, our students don't just excel academically, they develop the emotional resilience and ethical awareness to use their gifts for good. As an international baccalaureate school, our transdisciplinary, inquiry-based curriculum challenges students to make meaningful connections across subjects, while our supportive environment ensures they feel understood, seen, and valued. If you're here tonight, you likely understand just how deeply gifted children experience the world. Their boundless curiosity, their emotional depth, and yes, their struggles, particularly around rejection. Their sensitivity is often one of their greatest strengths, but it can also be one of their biggest challenges. That's why we're so thrilled to welcome Dr. Katie Bellin this evening. Dr. Bellin is a licensed clinical psychologist in the state of Colorado with extensive experience in learning assessments for children, adolescents, and adults. She earned her bachelor's degree in Spanish and pre-medicine at Wesley College before completing her doctoral education in clinical psychology at Fielding Graduate University's APA accredited program. Her clinical training includes work at the Community Reach Center, the Colorado Mental Health Institute at Fort Logan, and the Children's Hospital. Dr. Bellin also knows McIntosh well, not just professionally, but as a parent of 2 McIntosh alumni. Tonight, she'll be sharing her expertise on rejection sensitivity in gifted children, particularly those with ADHD, and offering strategies to help them build emotional resilience. Before we begin, though, I just want to take a moment and acknowledge something truly special about this room. We're all here tonight because we share a deep commitment, not just as educators and professionals, but as parents and caregivers who understand in a profound way the unique joys and challenges of raising and supporting gifted children. As we listen to Dr. Bellin, we may recognize aspects of our own children in her words, their brilliance, their intensity, their deep sensitivity, but we may also see ourselves, the ways we too experience the world deeply, strive for connection, and navigate the challenges of parenting and guiding these remarkable young people. So thank you. Thanks for being here. Thanks for showing up, for caring so deeply, and for investing in these extraordinary children, their growth, their resilience, and their futures. We are incredibly grateful to be on this journey with you. And with that, please join me in welcoming Katie Bellin.
Thank you, Annie. Thanks for your nice words, and thank you all for being here. It was intimidating to give a talk to a room full of parents of gifted children. So anyway, I appreciate your your attention and interest in this topic. Just as we're starting here, can I get a show of hands for anyone who enjoys the experience of rejection? Okay, that's what I was expecting. Rejection is universally, almost universally an experience that we do not enjoy. And it is adaptive to have an aversion to rejection. We live in an interdependent society, and to get along and be kind to each other and responsive to other people's needs, we have to be, in a sense, rejection sensitive. But there are some individuals in which this sensitivity is really heightened. Most commonly, it's been described in the ADHD population, but because gifted children and adults are, in general, can be more emotionally sensitive and emotionally intense, the experience of rejection can also be more intense for them. So I just want to say that everything that I'm talking about today is really quite relevant, I think, to all children in a certain extent, and any child who has that emotional sensitivity. In some cases, the rejection sensitivity is so intense that it really rises to a level of diagnostic relevance. And there's currently no diagnosis in the DSM for rejection sensitivity. But some of you may be familiar with Bill Dodson. He's a Denver area psychiatrist, ADHD specialist, and he's really the first person to describe this as a disorder, which he terms rejection sensitive dysphoria, or RSD. Because in a way it really looks like a mood disorder. And so there are, lots of people who have been misdiagnosed with bipolar disorder or personality disorders or other mental health diagnoses, when it's really rejection sensitivity. Currently, as I mentioned, it's not an official diagnosis. You can, as a clinician, capture it under an atypical depression diagnosis. But it's important to understand because it's a very different phenomenon than bipolar disorder, and when you know more about it, it's pretty easy to distinguish. But the actual changes in mood and reactions and behaviors can be quite similar. So if we think about, to describe the phenomenon of rejection sensitivity, and this can be a response to either a real or a perceived rejection experience. So it doesn't even have to be something that actually was a rejection, but it can be something that to the child, it felt like a rejection. It could be a misperception of a rejection. But it triggers an autonomic nervous system response similar to panic, where you immediately go into this fight or flight response. And the reaction often feels very outsized to the precipitating event. So it could be something so minor and the reaction is so big. And I think all of us as parents can probably think of half a dozen incidents just in the last week where that could have happened in our homes. The person who is rejection sensitive, often describes it as a combination of both emotional and physical pain. So there can be the tightening in the chest, the difficulty catching your breath, that feeling of sickness in your stomach, and also just the panic and the deep despair. Often what happens is that The rejection-sensitive person then engages in an emotional reasoning that's very common in anxiety as well. And emotional reasoning is that phenomenon where you feel this way, therefore this must have happened. So, for example, if we think about the fear of dogs, you see a dog and you feel a sense of absolute panic and fear, therefore the dog must be dangerous and a threat. That's emotional reasoning. You have no evidence to suggest that the dog is a danger or a threat, but you feel like you're under attack, and so you reason that that must be the case. Similarly, in the case of rejection sensitivity, you feel awful, therefore someone must have done something to hurt you, right? And so that is the the danger of emotional reasoning is that when you don't have anyone there to counteract this thinking process, then it just becomes your truth. So it adds to this narrative of kind of your history of being rejected by people in general. And so there's no one there to say, actually, I wasn't rejecting you, I just couldn't come over on the weekend because I had another obligation, but it wasn't about you. But there's no one there to tell you that, and so then you have this experience that you chalk up to rejection that then makes you more prone to feeling rejected the next time something happens because you're always getting rejected. So emotional reasoning can be kind of a big trap that people fall into who are rejection sensitive. So in general, if we think about the fight or flight response, of course with anxiety there's that freeze response too that doesn't really apply so much to rejection sensitivity. But there are common sort of externalizing responses and internalizing responses to rejection. And you know, the way a child responds to rejection really has a lot to do with other factors in their personality, whether they tend to be more externalizing type of kids or internalizing type of kids. There's obviously some sort of, you know, gender traditional stereotypes about boys tending to be more externalizing and, you know, girls tending to be more internalizing. There's some truth to that pattern, but of course every kid is their own person, and there's lots of people and kids that show a mix of both. So just to give like general categories, like just, you know, of the types of reactions that you might see first, and then I'm going to give some specific examples that I think may resonate with you. So among the common fight responses are lying, blaming or putting down other people, or lashing out at the source of the rejection. And then the common flight or internalizing reactions might be, you know, putting yourself down and feeling shame and then withdrawing. And I think, you know, especially with the externalizing reactions, those are often easier to identify right away because it's a very impulsive reaction that's everyone can see, right? And this is the nature, of course, when a child has ADHD as well, and when they're just kids, right? Kids are impulsive because their frontal system hasn't developed fully yet, so they're already a little bit more prone to impulsive behaviors. But when they're externalizing, when they tend towards externalizing behaviors and they're impulsive, then it's quite immediate, and you can sort of track it to what caused that pretty easily. The internalizing reactions sometimes can be a little bit harder to figure out why your child is so upset or mopey or in their room, and I don't know what happened. But I think it's still important to think about specific examples, because even in the case of externalizing reactions, sometimes we think we know what's going on, but we don't understand that rejection sensitivity is really at the core of the behavior. So I'll give you an example. Lying is just such a common reaction to try to, avoid or like a reaction in the face of a perceived rejection. The example I always give is my daughter is very, very rejection sensitive, and when she was in first grade, like many kids do, she impulsively cut her hair, and then, as many children do, tried to cut it even shorter to try to make that go away. So she comes into the house, and her hair's in front. Yeah, she has micro bangs, and I'm like, what, May? What'd you do? And she would not acknowledge it. She's missing hair. There's a giant clump of hair in the trash, which if you have an ADHD kid, you know that they are also terrible at disposing of evidence. So everything's laid out there, and yet she's still like doubling down on, I did not cut my hair. And so I think when we think about this, like on the outside, it feels like the lying is to get out of trouble, which is kind of true, but it's deeper than that. It's really about, because for immediately this wasn't something that she was in trouble for. I mean, she cut her own hair. What am I going to do? Like glue it back on or something. I mean, there's nothing to do. So, but it's the disappointment and that emotion, that her anticipating my disappointment in her, that is really at the root of it. And so you may find that your kids impulsively lie about, did you brush your teeth? Yep. And it's true, it might be just because they don't like brushing their teeth and they don't want to have to do it. But for rejection sensitive kids, often the reason for the lying is because they don't want you to be disappointed in them. And so that's an important distinction, I think, over time, because it helps really, it's just it has a different quality to it than just the lying, like, I don't want to do what you told me to do, and I'm just going to pretend like I did. So the other piece that can be a little more subtle than it might, seem at the face of it, is this lashing out at the real or perceived source of rejection. So sometimes kids that are rejection sensitive, if they feel that they are not highly regarded by someone, it could be a teacher, it could be a parent, it could be another child, they may lash out with no obvious event that came, there was no obvious trigger, but they're just snarky and nasty. And what I've found in, the kids that I work with who are rejection sensitive is that the feeling of rejection can be kind of a pervasive underlying tone in a single relationship with someone. So when a rejection sensitive kid feels like, maybe there's one parent who's more impatient or frustrated with their behavior and maybe isn't as good at showing love or appreciation for all the things they do wonderfully, then that parent is often, there's more lashing out and emotional reactivity and towards that parent. Same thing with teachers or other adults that care for the child. If the child feels like a teacher does not care for them, and they know they know this so well, and you as parents can try to talk them out of it, but they will know if a teacher does not enjoy them, and then you will find that there's more butting of heads and lashing out and bad behavior, and the rejection sensitivity is often at the core. So I think, sometimes even though those externalizing reactions can seem quite transparent, it's really helpful to, once you know that a child is rejection sensitive, you can kind of see a lot of things in that lens. And it's helpful in terms of just kind of treatment and strategies to manage the rejection sensitivity. Of course, the internalizing reactions in many ways can be quite damaging, because shame and withdrawal and isolation and self-denigration, when it's internal, we as parents don't always have the opportunity to counteract those distorted thoughts. And so then they just are kind of sitting with that, and it can later lead to more challenges. So additional things that are important just to consider when we think about rejection sensitivity in the context of ADHD, of course, as I mentioned before, the experience of rejection can be a misperception, because the child with ADHD did not attend to all of the context of an interaction, and maybe personalized something that wasn't even meant, wasn't even directed at them. Or, a friend is grumpy, talk to them in kind of a snarky tone, and they feel rejected, but they sort of missed the whole point that it's not about them. So there can be a lot of misperception that happens, causing, more rejection experiences. And then, the child with ADHD who is impulsive and struggles with self-regulation naturally has many rejection experiences that are real rejection experiences. There is a researcher at Harvard that estimated that the average child with ADHD experiences 20,000 more corrections and negative feedback experiences than the child, by the time they're 10 years old, than the child without ADHD. So you can just imagine, if you're rejection sensitive and you have 20,000 more experiences with rejection, how that impacts your self-esteem. And then, of course, when they're when they tend to be an externalizer and they respond with a fight response, then even if it wasn't a rejection to begin with, well, now it's a rejection because you've lashed out at someone and then they're not going to be taking that well. So it can be this loop of constant rejections over and over again when the behavior is so poorly regulated. And then, the other piece that can make it challenging with ADHD and also anxiety. So if a child, a gifted child who doesn't have ADHD but is rejection sensitive and anxious and can be a little bit rigid in their thinking, then they can be very black and white in relation to their rejection sensitivity. So they either are the best or they're the worst. And that's a hard place to be, because you're rarely the best, right? So most of the time you feel like you're the worst. And that, anyway, so there can be some sort of a tendency to be, to overgeneralize these internal feelings of rejection to kind of, like your whole self. And then the thing that I think is really, really important and so challenging in this moment is just the influence of social media and how much that contributes to rejection sensitivity. We know, I'm sure all of you have, read the research on the ways in which the curated pictures of Pinterest and Facebook give people a false sense of other people's lives, and this, the FOMO and the feeling like your life isn't as good as theirs. Well, if you're rejection sensitive, imagine how much your young child with not a fully developed brain and who's rejection sensitive going to social media and seeing, even if they know that it's not real life, seeing my friends are hanging out and having a good time, I'm not there, anything, or just the comments that come in on social media. There's always someone being, unkind. So social media is like, you can't get away from the rejection sensitivity if you're also on social media. Okay, and then experiences of rejection can be indirect. It can be something like, everyone's talking about a movie and you say, I really love The Princess Bride, and someone else says, oh, I don't like that movie at all, my favorite movie is this, and then that's a rejection experience for that child. So it can crop up in all sorts of places when that sensitivity is so heightened. So when someone is acutely sensitive to rejection, they typically develop a system of strategies to avoid rejection, as we all do. If there's something that's really painful for us, we try not to experience it. So if we're very, very scared of dogs, we're going to try to not be around dogs. With rejection sensitivity, that is such a common experience for all of us in everyday life that it's really hard to avoid. So, you may see such strategies like only engaging in tasks and activities when you're sure to win. Gifted kids especially struggle with this because they often win at stuff. Often they are the best in their math class, or, school comes easily to them. They have all A's. Or if they're a gifted athlete, they pick up stuff and they can do it right away. Or if they're, there's these areas in which they're so advanced that they really become so accustomed to success and then really, really struggle to do anything that, doesn't come easily to them. And it can be a very narrow experience for these kids that sort of only stay within that comfort zone. They never get to experience the limits of their abilities. Perfectionism is a very, very common response to rejection sensitivity. So, and this is one of the things that I find as a clinician very easily masks ADHD, because if you have the child who has ADHD and they're rejection sensitive, and then they respond to that rejection sensitivity through perfectionism, no one is going to rate this child as having ADHD symptoms, because they're going through so many, so much effort to make sure that they don't make a mistake, that they hand their stuff in on time, that they're never the bad kid in class. And so their behavior is very constrained and they're very tightly wound, but they don't look like they're inattentive because they're so perfectionistic. I treated a young woman once who was so rejection sensitive and anxious, and she had ADHD, and so she was always missing the assignments in class. This was before COVID, before people put things online, so she would miss what the homework was. And so she just every night would go and do every single problem in the back of the math book just to make sure she didn't miss something. So she was staying up all night long, doing just loads of work, because even asking for clarification was an acknowledgement that she missed something, which to her was like a feeling of rejection. Quitting, giving up easily, when you're faced with a challenge. If I don't try, then I can't fail. Attempting to control situations, wanting to be the one in charge so that you can manage the game or the activity to make sure that you win or you get the role you want or you're, sure to succeed. Cheating, very common, because it was funny, I was giving this talk, my husband said, are you going to fly our nephew in as an in vivo case study? Because he is like the most rejection sensitive kid I've ever met, and he is 8 years old and still cheats at every game he plays. And you can't call him out. He lies about it. He doubles down, And then when you catch him, he cries and throws a tantrum and runs away. Every single time. Every time. So anyway, it's not because he just can't stand that feeling of like not, I mean, it's so painful for him, which when you're not rejection sensitive sounds ridiculous, because now everyone's annoyed at him and now he's really being rejected, but he can't tolerate it. So, and then the thing that I think is really important, and I see in a lot of the adults that I work with ADHD, is the avoiding intimacy and friendships. I see a lot of adults who maybe they have a spouse, but then they don't have any other close friends because it just feels too risky. Like they have a lot of acquaintances, they hang out with a lot of people, but they never really let anyone in because people are unpredictable and it's very painful, as we all know, to be rejected. Of course, avoidance is very helpful in the short term, but not in the long term. When you don't take risks, you don't, as I said, you don't test the limits of your abilities, you end up underachieving. Social avoidance increases risk of social anxiety. I don't know if any of you felt this after COVID when we were forced to avoid social interactions, and then, I mean, anyway, it's interesting the way that just becomes harder to do if you avoid it. And then there's higher rates of depression in individuals with rejection sensitivity. You can't selectively avoid negative experience. So if you really narrow your life to include only the things that you think are sure to be positive, or sure to avoid the negative of like rejection, you're going to cut out positive experiences too. It's like if it's like the person that went through the pain of losing a pet, and then they said, I'm never going to have a pet again, that was too painful. Well, then you miss out on think of all the years of joy that you've had with that, animal that then you've kind of cut out of your life. Gift dogs as a lot of examples I'm utilizing in my talk, so anyway. Okay, so I am going to show this quick video because I think it's just really it's the best one I've seen that describes rejection sensitivity, and it talks a little bit about how to manage it, and which I think is a nice segue into the next part of the talk, which is just about how we manage this and help our kids. I'm going to try, I think this volume or the sound might be a little bit hard to hear, so we'll see if it works, and then if not. Okay, so I just really like that video because I think it just, firstly, it felt very validating to me because it was like all the things I had shared with parents based on my own personal experiences, both as an adult who is rejection sensitive, having children who are rejection sensitive, and just working with kids with rejection sensitivity. And so to see this validated it was really great because, as she says, there really isn't research on it, but everyone who works with people with ADHD, with gifted and highly sensitive kids, know this is a real experience, and for some people, it is the most impairing symptom of ADHD. So anyway, it's just, she actually has a YouTube channel and just a lot of great videos. She's not a researcher or a therapist or a psychologist, but she has kind of committed to understanding herself, and through that has made these really helpful resources. Okay, so let's talk about parenting strategies. So this is the part where I really, really want this to be a discussion. I'm going, have some things I'm going to present, but, I want you all to jump in, ask questions, and, the rest of this talk is really, I want this to be helpful. So, we don't have to go according to my slides if there's things that people want to, specifically want to ask. So, so it can be really, really hard parenting a child who's rejection sensitive, because your whole job as a parent is to help them learn from their mistakes and grow them into adults. And we can't do that without pointing out those mistakes and helping them learn from them. And that is inherently a rejecting experience. And so, the strategies that these kids use to try to avoid rejection just ends up kind of impairing their social emotional growth, like, the not sharing an idea, not being the one to choose the dinner, because what if you pick something and no one else likes it, or just going along with what everyone else wants, not contributing to the dinner discussion because you're worried that your idea, isn't going to be the best one at the table. Or there's the child that when something comes up that they really do know a lot about, they sort of start that bragging or mansplaining to everyone, just to build up that sense of I'm the best. For the perfectionist, there's that over preparing for things, or not putting forth effort. Another really common thing, and I would say this is more common just anecdotally in girls that I've worked with, is this sort of excessive apologizing and preemptive excuse making. Like, I'll be working with someone and testing them, and right out of the gate they'll say, "Oh, I'm really not very good at, X, Y, or Z," or I would be better today, but I just didn't sleep very well last night, or it's sort of just like setting you up for low expectations. And so these really impair growth. So how do we, as parents, provide feedback to these kids and guidance, while sort of managing their rejection sensitivity? And I think this sort of, it might be, I don't want this to sound invalidating to talk to parents and talk about unconditional positive regard for your kids, because of course we all love our children unconditionally, but positive regard is a little bit of a different thing, because kids with ADHD, kids who are gifted, sometimes they're not likable. We all have those moments where we love our kids and we throw ourselves in front of a train from them, but we don't actually want to be with them. And our kids know that when we feel that way. It is palpable to them. And so this is really, really tricky. And how do we make sure that they know how highly we regard them? And kids, especially kids with ADHD or other behavior challenges, often behave in ways that are unpleasant and impulsive and, oppositional. And so this is so important to catch these kids being good. And make sure that you are giving them as many wins as you can. I think, there's we're in this age of the helicopter parenting that's been talked about a lot, of people sort of, I think Ms. Posback was talking about the lawnmower parent, clearing the way for the kids. And we don't want to be helicopter parents, but we have to keep in mind that kids with ADHD in particular are struggling a lot all the time. And so if we can set up some like sure successes for them when they're not in school, like school in particular can be, very hard. Or if your child has dyslexia or other learning differences, they are working hard and experiencing failure all day long. So as much as we can kind of increase the numbers in the W column for them at home, we should do that. So set up scaffolding and support, make it just impossible for them to fail at things. And then make sure that if there's something that they're really good at, that you give them an opportunity every day to engage in that task, and so that you can praise them. They have to see how highly you regard them all the time. And then, they'll at least have that trust, that sense of the relationship at the heart, at the base, for when you have to come in with the corrective feedback. Always important to praise the process and not the outcome as much as you can. This is really important for gifted kids, because gifted kids often are really good at going for that gold star, and often they don't have to even try that hard to get the gold star. And so when you're just really excited about the gold star, they learn just what they have to do to get there and nothing else. And then when they don't get the gold star, that is a really, really hard sense of failure and rejection for them. So being sure to praise the process. Kids with ADHD in particular rarely have a product that's error-free, if we think about school in particular. So, they'll write a paper, it's a total disaster, but maybe they have one beautiful opening sentence or transition sentence, or they used a great word in there. That's what you gotta make sure that you're highlighting before you jump in with the corrections. And make sure that it's, genuine and specific, and not just like, great job, Johnny, but I love how much effort you put into that paper, and that you really, really, your enthusiasm for Pokemon really came through. So as the video talked about, when the rejection sensitivity is triggered, you have to give them time and space to self-regulate. So sometimes you can do some proactive planning, like if a child is, going to a swim meet, and you can every time if they don't win, it's a disaster for your family. Could be really helpful to engage in some kind of discussion about what happens, maybe you won't come in first, what's going to happen then, and think about the different scenarios, and then strategies that have been helpful in the past, and how, what they can do to calm themselves in that moment. That's also really important for kids. Gifted kids in particular sometimes have very big ideas about the way something is going to go, or the product that they're going to create, and the outcome is never like that amazing. And so then there's this rejection experience of not meeting their own expectations. And so kind of doing some proactive planning and discussions about possibilities, possible outcomes can be really helpful. So especially when your child is really young, when they're in that mode, that fight or flight mode, as the actor talked about, you can't engage in some, strategy that you learned in therapy if you've never practiced it and it's not helpful, and they're not even going to be able to listen to you. So sometimes just having a visual cue can be really helpful of things that are helpful to them. Like if putting on headphones and sitting in the beanbag chair, or going outside on the trampoline, in the past has been really helpful. Maybe you have a card that has some of those options on there that you just hand to them. The other thing that, sometimes people do is have a jar of glitter, like water with glitter in it, and you shake it up and you just wait for it all to settle, and they can't talk or do anything until it's all settled, and you practice some deep breathing. So there are different strategies that may be helpful for your child, but as mentioned in the video, the instinct is to like immediately solve the problem, and so that it might be hard to initially to help them disengage and engage in a calming strategy. Sometimes also you could create, like with your own child, a symbol, some sort of object that has meaning, that reminds them of your unconditional positive regard. So in that moment where you've, corrected them, or they made a poor choice and you're telling them and there's a consequence and they are losing their mind because they feel like the worst kid ever, or they're angry at you for calling them out, maybe, the two of you have decided on something that reminds them of how deeply you love them. Maybe it's a picture of a time that you were together, or some gift that you bought them, just so that they can have like it's almost like a transitional object to move them through this mood state. Once they're in the yellow or green zone, then you can initiate a repair. So important to praise any time an adaptive strategy is used, because it is so hard to do that when you're activated, to not lash out, to not engage in something that's maladaptive. And then to really kind of start to use a common language as a family about risk-taking and making mistakes, so that it can become kind of like a mantra almost, so that they're reminded that this is their job as a child, because if they're not making mistakes, then they're not being challenged. Some kind of common language. The other thing that can be really, really helpful is because a lot of us as adults, I don't like to do things that I'm not good at. Trying to walk the walk instead of just talking the talk. There was one summer when I decided that I was going to jump in any body of water that we visited in Colorado, because my kids, I was trying to model risk-taking, and I am like the biggest wimp when it comes to cold water. And so there was one summer when like anywhere we went to a lake, it was 45 degrees, I would like jump in. I've never done it since, but I did it that summer, and like show, it just as a modeling, like I can do hard things too, even as an adult. So we adults like really need to be that model of risk-taking. I recently started taking piano lessons again that I haven't, played in 35 years, to try to because I like to do things that I'm good at. I don't, most of us do. So, and we can also normalize mistakes through just at the dinner table at night. All right, everyone tell me one risk you took today and one mistake you made. And then if you can't think of something, just make something up. Okay. So I think just, to end here, I do want to just talk about the fact that, gifted kids with ADHD, kids with rejection sensitivity often have parents who have ADHD, who are gifted, and who are rejection sensitive. And this can be a really tough dynamic. When your child maybe is an externalizer and you yourself are rejection sensitive, there can be quite a dynamic that is hard to, you know, to disentangle. So, you know, just to take a brief moment to share with you my own personal experience with rejection sensitivity. I really only came to understand that I was rejection sensitive when I was a parent of an adult with ADHD whose symptoms really caused pretty significant social, emotional, and learning challenges. My son was always getting in trouble. And for me, when he was in trouble, that I experienced a feeling of rejection on his behalf, but also of myself as a parent. And I think all of us as parents have those moments where your own child's behavior, you feel like it's a reflection on you, if it's something that's embarrassing or inappropriate. Even when we objectively know that they are their own person, it can sometimes be hard. So I remember the exact moment when the light bulb went off, and you know, the event was not even interesting or singular at all. But it was one of these moments where my son had gotten into it with a neighbor's kid. The neighbor called me, wanted to talk, and I just remember walking back from her house and having that like tightness in my chest, the sickness in my stomach, the perseverative thoughts of like, I'm the worst parent, everyone in the neighborhood's gonna know. I'm angry at my son, I'm angry at the other parent for calling him out. And then I feel this like shame and despair, and all of a sudden I'm like, I'm rejection sensitive. I was like, I've only been doing this for like 10 years, and now I'm realizing like that's what that's called. So it's just so interesting because when I found this out about myself, there are so many things from my history that started to come into like a sharp relief to me, where I now understood it in a completely different light. Like I have ADHD and can't remember anything about a book that I read 4 weeks ago, like not one thing. But I remember I have like a photographic memory for rejection experiences. I could list and tell you what I was wearing and what happened. And you know, now that I understand why that is, it's just very interesting to think about the choices and decisions and reactions I've made throughout my life to either avoid rejection or in reaction to perceived rejection. And I think that my son was, you know, it was a divine intervention to get a child that forced me to become aware of my own rejection sensitivity and like separate the two things, because you know, I just the personal growth that I experienced from just kind of understanding that about myself, and then being able to not personalize his behavior. I don't know that would have happened if I had had only my daughter, who is the one who's the perfectionist, rejection sensitive kid. So it's just, I think as parents, we have to think about, if we ourselves are rejection sensitive, I mean, can you like imagine a time when your kid comes home and they're like, my teacher said I was the worst one in class, and then you're like, what? And you fire off an email immediately, impulsively to the teacher, what are you doing calling out my kid for being the worst one? And later you're like, of course that's not how it happened. But so I think all of us, like we get our mama bear, but if we're also rejection sensitive, you know, it's really important that we kind of have this, that we know this about ourselves, so that we can have this moment of being like, let's be curious about this instead of just reactive. And sometimes we ourselves like need to take a moment and calm down and think things through, you know, before we react impulsively and then embarrass ourselves and potentially our children. Not that that's ever happened. Okay. So I think, in my training as a psychologist, the rule is never share anything about yourself. But I'm not a therapist. That's why I do testing. I think it's really helpful to because when I meet with parents who have rejection sensitive kids, and I can tell those parents are rejection sensitive, I feel like having someone just understand that can be just so connecting and meaningful. And so not to make it, not to overly disclose, but I think it's just, it's been really quite a validating experience for me to meet other people that are also rejection sensitive and know that this is just my brain. And it's not, I don't, not everyone in the neighborhood thinks I'm a bad parent. I'm going to end on that. I have my contact info there. I also have a list of sources that I can share with you guys. Some of them are just me listing sources because that's what you're supposed to do, but some of them also will be helpful so I can share my slides if anyone wants after the talk.